Good morning, Madam Chair and members of the committee. For the record, my name is Jeremy LaPlante, and I'm a lieutenant with the Keene Fire Department, having served my community for the last 15 years. I stand before you today to strongly advocate for Senate Bill 350, which seeks to bridge a critical gap in health insurance coverage for emergency response and public safety workers facing a prima facie or presumptive conditions. Every day, firefighters across our state put their lives on the line to protect our communities. Recognizing the inherent risks, New Hampshire law provides a prima facie or presumptive coverage for us. However, there remains a significant gap. Currently, if a firefighter is undergoing medical treatment, then loses their job due to the injury or illness, and their workers' compensation claim was denied, they face a precarious situation, lacking health insurance during a critical time. As a veteran firefighter, I have used my sick leave for various reasons, including COVID-19, work-related injuries to my foot and shoulder, and family emergencies, specifically the premature birth of my son. I currently have about 12 weeks of sick leave accrued. But what happens if I, or any firefighter, face a serious health issue and our compensation claim is denied? This is not a hypothetical situation. It's a reality we live with every day. We are then forced to exhaust our sick and vacation leave. And once that's depleted, the Family Medical Leave Act, or FMLA, only protects our employment for 12 weeks. After that, we're left without income and, critically, without health insurance. What does this difference in coverage look like for a family? Yesterday, I spoke with a colleague who was just diagnosed with stage 4 prostate cancer. One medication needed for 1 month to treat his cancer is $13,000. Luckily, with his health insurance, he's only responsible for the $40 copay. Consider some other potential but very realistic scenarios. A newly hired Concord firefighter and paramedic on their first day responds to an active shooter incident. The trauma experienced, physical, emotional, psychological, is immense. It may take time to rehabilitate after such an event. If this firefighter's compensation claim is denied, they face not just a daunting recovery, but also the loss of health insurance, with no accrued sick or vacation leave to fall back on. Similarly, a few years ago, a Manchester firefighter suffered a cardiac arrest while fighting a fire. Situations like these underscore the unpredictability and immediacy of the risks we face. Senate Bill 350 directly addresses these situations. It ensures that while workers' compensation claim is under appeal for a presumptive injury, the affected emergency responder retains their single-person healthcare coverage. This bill isn't about sustained income. It's about ensuring that during the most vulnerable times, our firefighters aren't burdened with the added stress of how to pay for their immediate medical treatments. No firefighter should face the haunting uncertainty of standing at the brink of unemployment, with their sole option being to pay out of pocket for their next mental health session, cardiac rehabilitation, or cancer treatment, all while their workers' compensation claim for a presumptive condition is pending appeal. In conclusion, I urge you, esteemed members of the committee, to support Senate Bill 350. This bill is not just a piece of legislation, it is a safety net for those who dedicate their lives to serving and protecting their communities. I cannot stress enough the peace of mind and security this bill will provide to our emergency responders. Thank you for your time and consideration, and I'm happy to answer any questions you may have.
Thank you. Any questions from the committee? Seeing none. Thank you.